Welcome to Medical Therapeutic Yoga with Dr. Ginger Garner. Chair. We will be practicing this pose from standing, using TATD breath, which video is available in this series. In the early part of the video, you'll see me pressing the knees into the hands, and that is in order to fire the deeper gluteal muscles, which provide a supportive sling for the torso and the body, and which often aren't firing enough to support daily activities. That will be one of our focus points for chair pose. Find a comfortable place on your mat with the feet hip-width apart. Lift the toes. Elongate the feet and then rest the toes back down so that you feel the front part of the heel contacting the earth. This solidly connects the feet to the earth. Finding spinal neutral. See video 5.7 in order to have more instruction, if necessary, on finding spinal neutral. Pressing the knees into the hands as necessary. Rechecking your spinal neutral and sitting back into the heels without letting the knees pass the toes. It isn't necessary to bring the arms above the head for chair pose. Most people benefit perfectly fine from only bringing the arms to shoulder level. If you have any shoulder pain or rotator cuff problems or impingement, then bring the arms even lower, then parallel with the earth. Recheck spinal neutral, using TATD breath, particularly during your transitions. This time, you can check the hip creases as you come into the pose to make sure that the hip flexors aren't overfiring, or one is firing more than the other, or less than, and that they're not dominating the movement. It also allows you to check for left to right symmetry to see how much muscles are or aren't firing. We'll repeat the pose several times, holding it longer if you would like to develop more strength and more endurance. There are also alternate positions for the hands. You can turn the palms up, which often helps if you have shoulder pain. You can also bring the hands into a prayer position, remembering not to bring the knees past the toes and not to grip with the toes. If you choose, the next time through, we can come into prayer hands with chair. Just checking position of the spine here. Prayer hands can help down train chest breathing if you tend to be a chest breather. Periodically check spinal neutral. Make sure you're fully using a TATD breath. Chair pose is a gateway to build strength and endurance for entry and in transition into almost all standing postures. Thank you for joining me.